Hi everyone, good afternoon. It's a raining afternoon, and I know everybody is indoors and we are feeling cold, which is also good for us because there was so much heat and we are enjoying the rain. Thank you so much. Thank you so much for joining us once again. Thank you so much. This afternoon, we are here to talk about spotting in pregnancy and also bleeding in pregnancy. So, we are talking about spotting in pregnancy and in pregnancy.
It's going to display where the serial number is equal to 1.
Sorry, due to one or two, we have to go off and we are back. Like I said earlier, it's a raining afternoon and it's chilly and it's cold, and most of us are indoors. We say thank you for joining us today. And it's a live program, so you should expect one or two things like this, always technical problem always happening, especially when it's raining. We all know. So forgive us, and we are back on your screen. Today we are talking about spotting and types of bleeding in pregnancy. So there are some which are normal, there are others which are not normal that we have to make sure we take notice of it to make sure our baby survives and survives very, very well. So early pregnancy, that is from day one you realize you are pregnant all the way to 16, between 10 to 16 weeks. Possibility that you can experience spotting in pregnancy is very, very high. So I would love my cameraman to show one of the photos that we have that you can see is spotting. Spotting is light in color, sometimes comes with the mucoid. It comes with mucoid in it, which is the spotting, and sometimes also you just see the light pink color, nothing more, nothing else. Now, early pregnancy spotting is often called implantation bleeding. That is implantation bleeding. You see that when there's fertilization and both the sperm and the egg meet together and is dragging it all the way into the uterus. Now, when the egg falls into the uterus, it needs to stay and survive. It needs to stay and survive. Now, if it needs to stay and survive, it has finger-like projections around it. That is the fertilized egg. And that finger-like projection actually start digging because it needs a place which is tortuous, which means there should be enough blood supply, there should be enough nutrients, everything that the egg needs to survive, it needs to be there. So that finger-like projection that we see, yes, on your screen you can see our first photo. So these are our first photo. So this is how implantation bleeding looks like. It's very, very light. It's not dark pink in color. It's light pink. It's not reddish. So when you see something like this is implantation bleeding. This one, there's no cause for alarm, which means the egg is finding a place that it needs to be so that the egg or the fertilized egg or the baby will be able to grow. So when you see something like this, you shouldn't feel alarmed at all. It's very light in bleeding, usually pink, not red. Sometimes also it is darkish red, so like deep brown red. And you will notice it either under your panty, or when you visit the washroom, you wipe yourself up. If you don't wipe, you won't see it dropping. It doesn't drop, it's there. Then you can only put panty liner. You don't need a sanitary pad. You need only panty liner to just be in your pant so that it wouldn't soil your pant. But when it comes to heavy bleeding, that's when you need a pad. Heavy bleeding, you don't even need to wipe. You immediately you sit on the toilet, you see that you are actually bleeding. So this is between 9 weeks and above. So the first one we saw was 4 weeks, and this one is 9 weeks. So you realize that whilst the pregnancy is growing, at the end of the day, the color actually reduces totally. It reduces totally. So this is 9 weeks pregnancy. Yes, this is 9 weeks pregnancy, and this is what you notice. So you could see there's mucoid and there's stains of blood in the mucoid. So it occurs when there is implantation. That's when you see this color. Like I said, there's a difference between implantation bleeding and bleeding in pregnancy. So at the end of the day, when you see this, yes. So with implantation bleeding, you feel nauseous, you feel cramps, then you urinate frequently, then few drops of blood. Duration, when you see that drop of blood, when it's dropping, is between 1 to 2 days. And this is the color that we normally see. But when it's your period, or when it's bleeding in pregnancy, you see it's heavy, it has cramps, you see all these things, and the duration is between 4 to 7 days. So, and the color is always bright red, nothing more, nothing else. And the same period also, these signs also goes when you are miscarrying. When there's miscarriage, this is what happens. You see cramps, heavy bleeding, you see clots of blood when you sit on the washroom. So There are key characteristics of early pregnancy or spotting. So there's light bleeding, that is, there's much less bleeding as compared to any bleeding, either your menstrual cycle or either bleeding in pregnancy or you are miscarrying. Then also with that one, you see just a spots, just few spots, one or two. Then the color is very light pink, very light pink. Then with others which are older, that's when you see the brown. Then also the duration, it often lasts a couple of days. When it's coming, it's between 1 to 2 days. It doesn't continue again. But when you are miscarrying, it can last all the way to 8 days. And when there's heavy bleeding in pregnancy, it can go as far as 6 to 7 days with bright red color. So let's pay attention to that. Then with associate symptoms with implantation bleeding, there's light cramps and there is slight discomfort, then frequent urination, then nausea. But with heavy bleeding in pregnancy or miscarriage, there's severe cramps, there's restlessness, there is temperature, there is lots of sweat, and there's severe discomfort. There's loss of appetite, and at the end of the day, there will be nausea. There are some who experience severe vomiting and severe nausea also. Then the timing for these signs that you see, for implantation bleeding, the nausea can last all the way to 3 to 4 months, and the vomiting. But with the heavy bleeding and the miscarriage, it can last for only 7 days. Then we recommend that while spotting usually is harmless, but it's important to see your midwife or your doctor to seek medical advice. There are some implantation bleeding which can lead to for you to lose your baby. So there are medications that can be given to stop the unnecessary outcome. There are some also which immediately they give you 1 or 2 medications, you should be okay. Now, don't forget, whilst you are pregnant, immediately you realize you have missed your period, you need your prenatals. You need to take your prenatals because it's very, very, very important. It is very, very, very important for you to take your prenatals because that one also protects you and protects the baby. Then one need to be concerned when you see that there is spotting. One, heavy bleeding that soaks through the pad and requires sanitary products. It is alarming. You need to seek medical attention. Bright red bleeding, especially if accompanied by pain, you need to seek medical attention. Bleeding that lasts more than 4 days, you need to seek medical attention. Foul smell, yes, there's some bleeding when it's coming. The blood smells so bad, but implantation bleeding, it doesn't smell. It doesn't have a foul smell. Then if you feel dizzy, you have severe lower abdominal pain, you are vomiting, you feel restless, there's high temperature, there's chills, there's excessive sweating, all these things you need to seek medical attention. Then also, it's good to always connect with your midwife. That's why in the antenatal booklet, you see that there are a lot. At the bottom, you see how your midwife's name needs to be there and her telephone number. because you don't know when the bleeding can be profuse. You don't know when the bleeding will be too much. Irrespective of the time, you call your midwife. Your midwife will be there to assist so that you get back to a nearby clinic so that you will be taken care of. And we are saying that everybody, whether you're a man, you're a woman, you are an auntie, you are a friend, we are saying that please, it's so advisable that you will seek early intervention. Early intervention is so important because when you have early intervention, if it's pregnancy, they will save the baby, they will save the mother, and the mother will be alive. So light spotting might be one of the first signs in pregnancy. So immediately you are expecting your menstrual cycle to start. You miss your period for 6 days, 7 days, and you see that light spotting. Please just try and do your pregnancy test and know if you are pregnant. If you are pregnant, you see early treatment as soon as possible. Then also, we are saying that implantation bleeding always happens when there's fertilization and between 10 to 14 days after conception. Implantation bleeding occurs around the time you expect to have your menstrual cycle. Yes, around your menstrual cycle. So, for instance, today you're expecting your menses to come today, and the menses is not coming. From Sunday, Monday going, and you see light pink or dark brown color that only a little in your panties, that should tell you possibility that you are pregnant is very, very high. Then also, danger signs that we also need to look out for. One, when there is ectopic pregnancy, you can experience bleeding. When there are placenta problems, you can experience pregnancy. When there is miscarriage, you can experience bleeding. So the bleeding, it could be ectopic pregnancy, it could be miscarriage, it could be placenta issues. All these things, we should know the difference. And there are some people also, they'll tell you they experience spotting all the way to their second trimester. Yes, they will do the labs, they will do everything. But those people, science and research has made us to know that those people, even though the baby is safe per the scan that they will take continuously, we realize that it could be that there's less progesterone in their system. So that is hormonal imbalance. Even though they are pregnant, the progesterone needs to be higher than the estrogen. But you realize that both progesterone and estrogen are at par, but they are pregnant. And the person does the scan, baby is fine. Placenta is at where it's supposed to be, but the mother keeps on having the spotting all the way to the second trimester. Those people are also there. That's why I said immediately you see your spotting, please call your midwife or call your doctor and visit them. Then when you miss your period, please, it's best you go and see your midwife or your pregnancy. Like I said, or your doctor, sorry. Like I said earlier, it could be a tube pregnancy, that is, or it can even, the fertilization can take place in your egg basket, that is in your ovaries. So it's not only when it lands in the uterus that you experience the spotting. The spotting can start by the time you realize it is bleeding. So when you realize your menses is not coming, you are seeing the spotting, Don't say, oh, midwifery said, oh, spotting means I'm pregnant. That is implantation bleeding. When there's implantation in your tubes, you experience implantation bleeding. When there is fertilization in your ovary, there's implantation bleeding. You can experience any of that. So we shouldn't sit and say that it's okay. It's not okay. It has never been okay. Now, in early pregnancy discharge, typically described as thin, clear, or milky white with a mild or odorless smell. With implantation bleeding, it doesn't smell at all. The increase of discharge, also known as leukorrhea, that is the whitish discharge that comes. It doesn't smell at all and it's normal. That is hormonal changes that you see. But when you realize that your leukorrhea, that whitish thing that you are supposed to see, changes and the smell that comes is foul smell, that should tell you that there is an infection somewhere and there is a problem also somewhere. Then the whitish substance that we see, it needs to be watery, it needs to be slippery. Then also that helps the pregnancy to progress. And that is telling you that when it's whitish and it's slippery, it is telling you the pregnancy is progressing. Nothing has changed. Now, when the color is clear and slightly white, at the same time also it's thin, watery, and more abundant than usual. The smell is also odorless and it's you don't smell anything. Then also the amount is tends to increase whilst the pregnancy also grows. Then it may be accompanied by urination. Let's keep our questions coming in so that I will answer your questions whilst we listen. Anything that bothers your mind, not specifically on the topic, as a nursing mother, as a pregnant woman, as a father who is expecting, or as an uncle and auntie, let's bring in our questions and let's answer it together. It is important to know that whilst this type of discharge is normal during pregnancy, it's always a good idea to consult the healthcare provider, particularly the foul scent, which is accompanied by itching, burning sensation, and the color could be gray, green, or yellow. Yes, yes, yes. Then someone will also ask, how can I differentiate between miscarriage, spotting, and pregnancy spotting? So, miscarriage, when you're about to lose the baby, then pregnancy spotting. So, implantation bleeding usually is light and may last a few hours or days, between day 1 to 3 days. Maximum is 4 days. Some people, even 2 days, they are done. They don't see anything again. And that one is mild cramp and less discomfort. But with miscarriage, it's heavy bleeding, bright red in color, with severe cramps. The cramps, you can't bear it. And it's so painful, very painful, beyond your imagination. Then also, at the end of the day, you realize that you have the edge, like pushing something out. But when it comes to implantation bleeding, there's no edge, the cramps is mild, the color is light pink or brown. You don't feel dizzy, you don't feel restless, you don't sweat, everything is okay. And with that one too, you only wipe. That's when you see. But with miscarriage, you don't need to wipe. The bleeding also comes with a lot of clot. Then what are the 100 signs of pregnancy in the first week? Okay, thank you for your question. Someone just sent me a question. One, spotting, light vaginal bleeding, then headache, dizziness. You get the bloating of your tummy, definitely. You feel that bloating. You try to even hold on to your breath, seeing your bloating will go down. It doesn't go down so much. Then you have cramp. Then your food cravings will change. Then you have acute sense of smell. Everything smells bad for you. Everything makes you annoyed. You are not okay with anything. Now, with implantation bleeding, you barely, when you are using the washroom, you barely even see any color in the urine. But with miscarriage, when you are urinating, it comes with color. So let's pay attention to that one too. Then our normal urine color during pregnancy is light or dark yellow, orange yellow. So when it's light or dark yellow, that is the typical range the color potential is shifting. That's hydration level and diet. Then clear urine. That one, the woman is well hydrated. The woman has no problem and the urine is so clear. Then orange yellow, some pregnant women may notice slight orange yellow in their blood. Urine is also a factor because of the bladder is closer to the uterus. So between the uterus, we have the bladder and the rectum. So there are triplets. We have the bladder, we have the uterus, and we have the rectum. So anything that affects the bladder, automatically it will affect the uterus. Anything that affects the rectum, automatically also it will affect the uterus. That's why before a baby will come out, the bladder needs to be emptied, the rectum needs to be emptied. Before dilatation, the child's head can descend all the way down before baby can come out. If the bladder is full, rectum is full, at the end of the day, you realize that there is no way baby can come out easy. It takes a lot of time for you to know baby dilatation to take place. It takes more time for the dilatation to take place. It takes a longer time whilst the mother is pushing for the baby to come out. That's why we always encourage our 4-star diet should be high fiber diet when you are pregnant. Every meal goes with fruits and vegetables so that you can have enough fiber. You wouldn't constipate because possibility that you be constipating when you are pregnant is very, very high. Then, after 20 weeks, when you realize still you are pregnant, but the color of the bleeding has changed from light pink to deep pink, all the way getting to bright red, that should tell you there's a problem with the pregnancy. It could be placenta problems, or it could be you miscarrying, or you are losing your baby, or the os is opened and the baby is trying to come out before its due time. So after 20 weeks, it's also very, very crucial. For the first and second trimester, all the way to third trimester, everything that we see is not normal. Everything that we experience is not normal. We are saying that it is so important that we pay critical attention to everything that we see, whether in urination, whether it's in spotting, whether it's awful smell, anything can trigger because we have ascending infection. when you are pregnant, even though the os is closed, when there's ascending infection, the os can easily open. Depending on the severity of what is happening there, the os can open and the baby can come out. So we are saying that please, let's pay so much attention to any bright red or any reddish color that we see. The ones that are not alarming are the light pink, the deep brown, the less cramps, frequent urination, the nausea, and the vomiting. That is our hyperemesis gravidarum. That one is not anything that is alarming that we should pay attention to. But at the end of the day, we are saying that it is so important that we pay attention, so much attention to the bleeding that we see. Now, let's delve deep down into types of bleeding which are normal. So, like I said earlier, we have the implantation bleeding, which is normal, which I've spoken about it. Then we have cervical changes. Automatically, when you have sex, you are prone. There are some women after every sexual intercourse, they experience slight, light pink bleeding. Just for about some few minutes, then that's it. Those ones are cervical changes, and it has to do with hormonal changes. It's normal. Then we have the subchorionic hematoma. Those bleeding are about when you are pregnant and you go and do the scan around the amniotic sac, there is a little bit of blood around it. Those ones are normal. Once the pregnancy grows, it will subside on its own. So it's harmless and it doesn't cause bleeding, severe bleeding, no. Unless somebody say we take the scan, that's when we see it around the amniotic sac. Then we have the serious bleeding that requires medical attention. The first one is miscarriage, that is loss of pregnancy during 20 weeks, often starting with light bleeding, then it increases in sensitivity, so and in severity also. So you see the light turning into deep pink, then to reddish, then deep red. That is telling you you are actually miscarrying, and it also comes with blood. Then we have the ectopic pregnancy also. The pregnancy develops outside the uterus, such as fallopian tubes, which require medical attention immediately. Then we have the molar pregnancy. That one, a rare condition where the tumor develops instead of the fetus. So you are pregnant, all right, but it's not a baby that develops, rather, it's a tumor. So fertilization will take place. You wouldn't see fetal pole, you wouldn't see any fetal heartbeat. You only see just the yolk sac, nothing more, nothing else. Then we have placenta previa and placenta abruptio. I spoke about it. That is the placenta problems that you can experience. That is in latter part of pregnancy. The placenta can cover the cervix. That is placenta previa, or separate from the uterine wall. That is placenta abruptio, leading to severe bleeding. And at the end of the day, when the bleeding starts, possibility that the mother can lose her life is high. The baby, we can lose the baby, especially when the placenta detaches. Baby is deprived of oxygen, baby is deprived of nutrients, baby is deprived of all the essential minerals that will let the baby thrive in the uterus. Baby is deprived of all, and we wouldn't get our baby. Then we have vasa previa. That one too, baby's blood vessels are exposed near the cervix, causing bleeding. Vasa previa. So I've spoken about three placenta issues, which are very, very important for you to pay attention. After 20 weeks, if you go and take a scan and your doctor or your midwife tells you there's possibility that you are about to experience placenta previa, placenta abruptio, or vasa previa, these three things, and your midwife refers you to a bigger facility, please don't go anywhere. Please go straight to the facility and let them save your life and save your baby. There are other causes which can also cause bleeding during pregnancy. One, infection, that is the STI, sexually transmitted diseases or infections. Then the UTIs also urinary tract infections, sometimes can cause light bleeding in pregnancy. So people can misinterpret the implantation bleeding to infections. That is when it's early pregnancy. That's why it's so important as a woman for you to pay critical attention to the type of fluids that comes out of the vaginal orifice. It's so important. Then also the smell, especially immediately you finish your menstrual cycle. Pay attention to the smell that comes. And when you realize you are pregnant also, and it's best to always use a panty liner. That is your tracker. It makes you to know if there is something bad about to happen or everything is good down there. Then always, we shouldn't forget this to cervical polyps. Yes, there are some, before even you get pregnant, your doctor will realize you have cervical polyps. So they will tell you, they'll do a surgery and take it out for you. Please allow them. There are some also, they get pregnant before you see the cervical polyps. Then the intervention that needs to be done, please allow them so that it will be done, because it's non-cancerous. It's not cancer growth, no, it's non-cancerous, and it's at the cervix, and it's so easy to start bleeding when there's pregnancy. It's so easy. Then there are important things that you need to consider when you see bleeding in your pregnancy, whether it's light, middle light, deep light, any bleeding you see, always you consult your doctor or your midwife. Let them know when you saw the bleeding. My cameraman, my viewers are saying they are not seeing my face, so please let them see my face, please. They are only seeing what is on the screen. Thank you very much. Thank you. They want to see my face, yes. So it's best for you to always consult your doctor, for your doctor to know when the bleeding started, when the color that you notice, how consistent the bleeding is. Then if you are using a panty liner, how many do you change? It's so important. It's really, really important for us to know that. Then also, we are saying that heavy bleeding or bleeding that accompanies clots and severe pain and severe cramps. When you realize this, when you know that I am experiencing something like this, it's best you call your midwife, you call your doctor, that since for the past 30 minutes or 1 hour or 15 minutes, 10 minutes, I realized that the color that was coming keeps on changing. Interventions will be done, your baby will be saved, and you will also be saved. Then also, bloody show. Bloody show means possibility that you are closer, baby is coming out is high, because when the baby is about to come out, there are some who see the show. The show is that mucoid with the blood in it. When you are 10, between 37 weeks all the way to 40 weeks, possibility that you will see a show is very high. So we shouldn't we shouldn't wait and say it's normal, it's going to go, it's not going to go. That is telling us labor has set in. If you've not packed your things, you are in trouble. That's why we always encourage, before you enter your third trimester, you should pack everything. Everything of yours should be packed so that either your water breaks, either you see your bloody show, either you start having that unbearable severe cramps that you can't bear. Any of them, you rush to the nearby hospital. You call your midwife whilst you're on the way to the hospital, and you go and push your baby out. Yes. As we know, it's really, really raining, yes. And we are in our rainy season. But don't forget, we have something for our viewers that we always share with them. We don't share with anybody than them. Yes. Our products. Yes. Our products. This season always calls for our oil and our petroleum jelly to prevent dry skin, cracks, and hardening of the palms. Let's go in for our petroleum jelly and our oil, because I know most of my mothers tell me that aside the baby, I also use it for a smoother and a softer skin to prevent cracks at the back of your feet, to prevent hardening of your palm. Always go in for our baby Customs baby oil and our Customs baby petroleum jelly, because it is mild on the skin. It doesn't react to any skin type. Anybody or everybody can use it. Aside our babies, is good for the whole family. It's good for the whole family. And our powder challenge is still on. Yes, our powder challenge is still on. Last month I told you, one big celebrity, big celebrity, yes. And fortunate for me, the person who sent that video to me is somebody who was so close, who is very close to that celebrity. Yes, they sent me that video. He actually said it's Customs baby powder that he uses on his face, because it makes his face smooth, it makes it softer. At the same time also, it is so mild on his skin. And the perfume alone in the powder, it's top notch. And after that, everybody started doing that challenge. It went viral. And I'm still telling our viewers, Customs baby powder is the best. It's recommended, and globally, there's no powder, there's no petroleum jelly, there's no oil that can be compared. There's no wipes that can be compared. There's no head to toe body wash for babies that can be compared to Customs baby products. Yes, I'm telling you, especially also the petroleum jelly. If you need to prevent hair breakage, no matter how hard the hair is, apply it, and you realize that it increases hair growth, it makes the hair softer. At the same time also, you can also apply it on your skin. It makes you refreshed, At the same time also, most mothers, aside the oil, they also use the petroleum jelly for massage, either on the foot, either around the waist for the baby, especially when the baby tries to start standing and sitting, start standing. At night, all you need is a little in your palm and you just apply it around the hip bone, at the back of baby's bum, under the feet, and you massage it gently, 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 gently. Then baby will sleep safe and sound. Now, I have a question here. What are the two main reasons for bleeding during pregnancy? Yes. What are the two main reasons? So the two main reasons bleeding in pregnancy, when the pregnancy is above 16 weeks, one, from your second trimester all the way to third trimester. The two main reasons are placenta previa and placenta abruptio. I spoke about it. So placenta previa occurs when the placenta covers parts. So we can have partial placenta previa and we can have full placenta previa. So the partial is when it covers part of the cervical os. And when it happens that way all the way to your third trimester, you can't have a vaginal birth. You are going to have a cesarean birth. Nobody, because where are you going to push from? So they are going to plan your delivery. And any doctor who loves you so much will tell you that it's best we plan you for CS. Take the baby out as soon as possible before labor sets in. Then the full placenta previa, that one, it covers the whole os. So baby can never, ever come out through your vaginal canal. It will never even happen. When we allow that, we are going to kill you. And that's what we don't want to happen. We don't want it to happen one single bit. So we will advise we take the child out, then the placenta where it is, the doctor can definitely take it out. Now, with placenta abruptio, the placenta has actually detached from the walls of the uterus. So baby is deprived of oxygen. Baby is deprived of the essential nutrients that the child needs to survive on. Then baby is deprived of oxygen. Baby is deprived of air. Because baby, when mother is breathing, baby gets some. When mother eats, baby also gets some, all through the placenta. So where it has attached to from the early beginning of the pregnancy, placenta needs to form. Immediately baby's heart starts beating, automatically it's telling you that placenta has formed, because baby will get its nutrients, its oxygen flow, its nutrients, its blood flow, everything gets it from the placenta. When it detaches and you're about 36 weeks, 35 weeks, 32 weeks, 30 weeks, they'll rush you for emergency CS and see if they can actually get the baby alive. There are some children who they survive even though the placenta has detached. They don't die. They come out crying and breathing. But there are others, before even they will cut and bring the baby out, the baby is far gone. That's why it's always advisable that when there's a problem and your midwife refers you and she tells you it's an emergency, right now, go and see the doctor. She makes all the necessary arrangements and she sends you. Don't pass anywhere. She's going with you. If it's a health center and there's no doctor there and she's going with you, please just follow her and let them make sure you are okay and your baby is okay. Then also, there are other possible causes. While placenta previa and placenta abruptio are most common cause of late pregnancy bleeding, other conditions can also lead to vaginal bleeding during pregnancy. So those ones are late, but the early ones can be ectopic pregnancy. It can be implantation bleeding, which I spoke about. Then there can be cervical changes. All these things play an important role, a major role for you to know that every bleeding whilst you are pregnant is very, very important. None of them should be taken for granted from day one all the way before you even push your baby out. Because even when labor sets in, we're expecting to see another bleeding, which is called show. There can be heavy show. There are some shows you think is placenta problem, which I've seen one before. You think it's placenta problems, but it's not. There are some also which at the end of the day, they are normal show that you will see with the mucoid. So every blood per every stage of your pregnancy, for the first trimester, we are expecting to see implantation bleeding. That is the light pink and the dark brown color. Second trimester going, we are expecting to see no blood. But when we see the blood, it could be placenta problem, which I've spoken about. The placenta abruptio, the placenta previa, and vasa previa. These three placenta problems, which I've spoken about it. These three placenta problems. Then we have the latter part also. The latter part is the show. That is when baby is coming out. We should also pay critical attention to the discharges that come, because UTI or STIs can also cause bleeding in pregnancy, either in the first trimester, second trimester, third trimester. That's why when you come for antenatal, the labs that we do, we screen you for sexually transmitted infections. We treat you for we screen you for sexually transmitted infection, and we also screen you for urinary tract infection. At the same time, paying critical attention to the urine that comes out when you are pregnant. We shouldn't forget all these things because they are so important in our lives as women who are pregnant, who are expecting. It's so important that we realize that every bleeding or every spot or every color change we see in our vagina is important. We have the period, that is our menstrual cycle, which lasts from 4 to 7 days, depending on how your cycle is. We also have the implantation bleeding. The implantation bleeding can last between 1, 2, 3, 4 days. That is maximum. You are not supposed to cross 4 days. We can also have bleeding that can be ectopic or tube implantation. You can miscarry. That one too is a type of bleeding. At the same time also, there is another one, which is the placenta problems. Whilst the pregnancy is growing, in your second trimester, the pregnancy is growing, and that bleeding also occurs. We should pay attention to that. It's not normal. Anybody who tells you, your mom or your auntie or anybody in your home tells you, in our house, there when you are pregnant, you bleed. It's not normal. because too much bleeding also can cause anemia in pregnancy. So anything that you see as a pregnant woman, it's so important for you to call your midwife, to call your physician or your doctor, to let them know that I'm experiencing this type of bleeding and this and that is happening to me. What should I do? Any instructions your care provider gives you, please rush and do it. And the last is the show. That is when baby is coming out. We are expecting to see that the show comes before the baby comes out. So implantation bleeding is light pink in color and is dark brown in color with mucoid in it. Any bleeding you see which is not light pink in color whilst you are pregnant, it means there's a problem and you need medical attention. Would like to say thank you to all our viewers who joined us today. Even though we had problems here and there, they still stick with us. They still came to listen to us. They still join us and they still learn from us. And thank you for all the questions that came through. We'll say thank you so much. We are still expecting more questions. If you would like to bring in your last question before we sign up and say bye-bye to you. We'll say thank you to Kasim's baby for always having our back. I say thank you to all my crew members who are always here to actually make sure the program comes on. To our viewers, we say we love you so much that you always join us every month for us to share the little that we have to what you already know. Yes, to what you already know. We just share the little that we have to what you already know, so that we all come together and say knowledge is power. Whilst we enter May, we are celebrating all midwives in the world. Yes, including myself, because I'm a proud midwife. Yes, anywhere I go, I say I'm a proud midwife. Because if anybody is alive today, the person should always thank the midwife. From day one, it's the midwife who brought Jesus out. Yes. When you read the Bible, when you even read the Quran, the midwife's name is already there. So if you are alive today, you should always thank the midwife. In May, we are going to celebrate all midwives in the world. Any midwife you know who has helped you before, come into our comments, drop in, give a shout out to all the midwives who has actually been there for you. And let's celebrate it in a grand style. And let's acknowledge all midwives across the globe, because that day in May is their day. And that will even empower us as midwives to give in more than what we are doing, to give out the best that we are doing. Because if you are alive today, you should thank the midwife. Without the midwife, there will be no babies. Yes, because the midwife is a family planning nurse or midwife. The midwife at the same time as a community health nurse. The midwife as a delivery midwife or a delivery nurse. The midwife as a counselor. The midwife as a lawyer. The midwife as a judge. The midwife as an advocate for all women in this world. And the midwife also as an advocate for men also in the whole world. So we thank you, we love you, and to everybody, just remember, if you are alive today, thank the midwife. Bye.